In this video, I'm going to demonstrate functional dry cupping to the mid-thoracic area of the upper back. Absolutely, you could do the traditional static or sliding techniques around this part of the back, but with the movements in this seated position, it's a great way of producing that functional release, and also for the client to feel how they should be moving around their area. Quite often, if clients have got an awful lot of tension in the mid-thoracic region, they can get stuck into one position, especially into a protracted position, and not necessarily sure how to move around that area and how to reset that body's positioning. So these functional movement techniques are a really nice way to decompress and to produce that relaxation response in the muscle tissue. Okay, so because Lydia is going to be moving in a moment, we do need to apply medium to the area of where we're applying the cups. One of the reasons is because the tissue is going to stretch and we don't want to produce too much friction between the cup and the client's skin. So we use that medium in order to reduce the friction when the client is stretching, and also to create a seal between the cup and the client's skin as well. So today I'm going to be using the handsole cups, which you can get from Amazon and other areas. The lotion that I'm going to use today for the purposes of this video is the Physique lotion, but you could use any other medium as well, such as your wax or your oil. Doesn't really matter, just use the medium that you already use within your clinical work. Okay, so I'm going to apply the medium to the area, just coming below those straps. So the area that we're focusing on is this mid-thoracic region. Okay, so mid-fibers of the trapezius and rhomboids as well. Okay, so that medium doesn't need to be fully massaged in. Absolutely, you may have already done some manual massage to this area in the lying position, so your client might already have medium on there. That would work really well too. Okay, I'm going to use the standard size cups to start with. The first cup I'm going to place is directly in the middle of the scapula. We often find that there's a common trigger point in the middle of the back of the scapula. So that's quite a nice area to place the cup. Okay, and then I'm going to place a few more cups in the middle of this thoracic area. Okay. Now remember, when you're applying the cups, the more cups you place onto the client, the more that's going to increase the intensity. So you need to take that into account. So the cups should feel comfortable for the client before they start doing those movements. How does that feel, Lydia? Excellent. Okay, so I'm just touching them all again just to make sure they all feel nice and secure, because quite often as soon as we start these movement techniques, the cups might start flying off. Okay, right, so the first movement that Lydia is going to do, she's going to do one arm at a time, and she's going to come into horizontal flexion. So she's going to abduct the arm up here. So I'm lightly guiding her just so she knows the movement I want her to do, and then she's going to bring that arm across the body. Okay, she can either bend the elbow so that arm can come further over, or she can keep the arm straight. It doesn't make too much difference. And you can see here, as she's doing that technique about 3 to 6 times, you can see that there's a stretch in these cups. Excellent. Can you feel that? Perfect. Okay, so she's done that one 3 times on one side, so she's going to come on to the other side. You could alternate those arms as well. Either will work really well. Okay, and again on this side we can see that the tissue within the cups is stretching quite nicely. Excellent. Okay, and then from here we can also get the client to do both arms together, but really focus on producing that protraction movement as if you're drawing those shoulder blades away from one another and sort of shortening the area of the front of the chest. Okay, so if you bring those arms in, you can cross those arms over so you get that nice stretch. Perfect. And then back, and then again. And you can see now that all of these cups are moving and sliding slightly. Perfect. And this time, if you focus on keeping those arms after you finish this repetition, perfect, and relax. And this time, if you keep those arms relaxed and then draw those shoulders towards one another into that protracted position. Okay, and you can see here that movement and that stretch that's being produced in that upper thoracic area. Perfect. And then one more time. So Lydia is drawing the front of the shoulders towards one another to create that rounded position. Excellent. Okay, so that was our functional dry cupping to the mid-thoracic region.